get started with that wimpy little hammer. And, okay, so I'll call this meeting of the El Paso County Public Health Board of Health to order. It's 12:03. And the first item is just our roll call, so we'll start with that. And Vice President Doris Ralston.
Here.
Commissioner Geithner. Here. And Commissioner Nelson is excused. Correct? She's not going to make it, right? Okay, so she's excused. Mayor Dixon, I see you. You're looking like a traveler there. Okay.
Yeah, I'm here and I'm present and in a parking lot west of Kansas City, Missouri.
Okay. And we'll adjust your volume. You're low, but I think it's on our end, not yours. So we'll adjust your volume. And I believe, great. Yeah, that's real good now. Hunter Barnett, he texted me yesterday, and he may have difficulty making it, or he might be in and out. So we'll see if he makes it. But for now, we'll call him excused. Dr. Chan.
I'm here.
Okay. Well, and good afternoon, Dr. Chan. Courtney Salt?
Here.
Okay. And Dr. Vu?
I'm here.
Okay. Thanks, Dr. Vu, for making it. So with that, we'll move on to item number 2, which is the approval of the agenda. Could I have a motion and a second to approve the agenda?
I'll move to approve the agenda.
Okay, we'll call it as Dr. Chan made a motion to approve the agenda and Commissioner Geithner seconded it. All those in favor, please say aye.
Aye.
Any opposed?
Aye.
Okay, and so that unanimously passes. I didn't hear any opposition. Board of Health comments. I guess we'll go ahead and do this. Do we have any comments from board members? And this is this extra meeting, so I think we're all, in the interest of time, we'll hold our comments for our regular meetings. Next up, item number 4 is approval of the minutes for the June 25th meeting. I would ask for a motion and a second to approve the minutes.
So moved.
Thank you. So motion by Commissioner Geithner. Is there a second to approve the minutes?
I'll second.
Deborah
Okay.
Chan.
Well, thank you, Dr. Chan, but Courtney Salt
Okay.
here in person came in under the wire. And are there any adjustments to the minutes? Any corrections? If not, then all those in favor, please say aye.
Aye.
Any opposed?
Aye.
Okay, any opposed? So that also passes unanimously. Item number 5, moving right along, is public comment. Do we have anyone in the room who wishes to make public comment? Amanda, do we have anyone that signed up or online?
There are no public comments online.
Okay. Well, that was pretty speedy. I didn't start off with saying good afternoon to everyone. Thank you for being here for this special meeting of the Board of Health. Especially thank you to board members who made it in person and to those who joined online. With that, we'll get to item number 6, which is new contracts, and I will hand this off to our director, Deanne Ryberg.
Thank you, everybody. And I would just like to start by thanking the board for convening today and working with us on the scheduling of this meeting. We typically only convene once a month, but due to some delays in contracting, we needed to add an additional meeting. So I appreciate everyone's willingness to accommodate this additional meeting. And I'd also like to take a moment to thank our staff who make this possible. We have our administrative team, our Board of Health liaison, as well as our AV team member who runs the AV for these meetings. So thank you everyone who was involved in making this meeting possible. And I know we've added additional board members since We last discussed contracts, so I just wanted to briefly recap some of the need for this additional meeting. And as the local public health agency, many of our program areas are contracts that are funded through state and federal dollars. We are in a period right now where some of our contracts are being delayed as there's changes in federal priorities and staffing at the federal level that have impacted some of the distribution of notice of award to states. States are also changing some of their processes about how they contract with locals. So on the local implementation arm of governmental public health, we are kind of on the receiving end of some of these delays. We would typically have presented these contracts in June, but because of delays, that's why we're meeting today. And then for these contracts, I'm very pleased that we received the first one, the Public Health Emergency Preparedness, in advance of this meeting. And down to the wire, we received the city's readiness initiative yesterday afternoon. So we have both available to vote on today. So thank you. These contracts both have effective dates of today. So thank you for making this possible. And then I'd like to just talk a little bit about the first two contracts that we have available. Typically, we would have our division director, Janelle McNair, here to present these contracts to you. Due to the scheduling, she is not available today, so I'll be presenting them. I would also like to recognize Daryl Kirby, who is in the room with us. Daryl is a member of our emergency preparedness and response team here at El Paso County Public Health, so he is also available for any questions that the board may have regarding specificity around these two contracts. We have them listed as new contracts, and that's because we're in the beginning of a new 5-year cycle for this funding. Both of these contracts have been in place for a considerable amount of time in public health. The first one, Public Health Emergency Preparedness, that we call FEP. This is funding that originated in 2002 after 9/11 and anthrax attacks. Public health moved more into the space of being part of the responder community. And that really started for El Paso County Public Health with this funding in 2002. And then the City Readiness Initiative, CRI, is additional funding that supports large population concentration areas across the nation for enhanced public health response and readiness. And that funding initiated with us in 2010. Next slide, please. So before we go into the contract, I wanted to just briefly provide a little bit of overview of our emergency preparedness and response program area that is supported by these two contracts. Both of these contracts are entirely federal funds that come through us as passed through from the state, and they support a variety of response activities for us in El Paso County. In the upper left-hand photo, you see our mobile team going out to respond to measles. For board members who were with us earlier this year, you're well aware that we responded to measles in June, and that is an example of our team going out to community to support a work site that had a prolonged exposure with a team member who was infectious at the work site and a multitude of exposures. So we went on site to respond to that, to help individuals assess their immunity and to provide post-exposure prophylaxis, because after an exposure, for individuals who are vulnerable, post-exposure prophylaxis, we have a 72-hour clock to provide that vaccination. So part of the reason we mobilize quickly for these situations to provide that resource for individuals who want that. We also provided titer clinics there, so individuals who didn't know their immunity status but believed that they had been vaccinated could have the opportunity to assess their immunity status as well. And that's an example of public health serving as the lead agency for a response that falls under our authority. The next picture to the right is a photo of the Planned Parenthood shooting. And certainly in a situation like that, we are not the lead agency. Of course, that falls to law enforcement. But that is also where we have a support function as part of the emergency response community in El Paso County. So for that example, we were coordinating behavioral health services for, in partnership with community providers to support individuals impacted. Lower left is the Waldo Canyon fire. which many of us remember. And that was an area where, again, we're not the primary responder, but we are a support entity. We helped with coordination of services for evacuated families and re-entry guidance for families. And then the lower right-hand picture is the fire that occurred in downtown Colorado Springs in 2023. Again, we served in a support capacity. There are a lot of retail food establishments in that area that were impacted by the fire. So we worked coordination with businesses, especially retail food, to provide them with guidance about what to anticipate regarding delays in utilities, impact to storage of food, and safe reopening of their kitchens. So that gives you a little bit of a sense of the different areas that our emergency preparedness team responds to when we are activated in various capacities in El Paso County. Next slide, please. So in September, that is National Preparedness Awareness Month. So we will have more detail for you about our program and how we fit into the emergency management community at that meeting. For today, I just wanted to highlight our role as a lead agency in specific areas, and that is under our statutory authority to investigate and control causes of epidemic and communicable disease. We have certain conditions that are reportable conditions that we are mandated to respond to and investigate. And we follow an incident command structure, much like police and fire, although our responses are, of course, very different. They tend to be longer and perhaps in some cases a little bit slower moving, but we follow that same structure, and our EPR team is part of how we prepare and organize around that incident command model, and they also coordinate training so that all of our team members in public health are trained in incident command. And then we work in close coordination with Pikes Peak Regional Office of Emergency Management, and one of our I would say achievements in recent years has been greater integration with PPR OEM, in that we have a liaison assigned to PPR OEM, and we work in close coordination on various planning aspects for the entire community. Next slide, please. And then just including this to give you an example of some of the things that our emergency preparedness and response team support us with when we are responding as the primary agency. The most recent example of that being measles. One of the things that we do is monitor emerging situations. So, of course, there were increasing cases of measles in other communities prior to measles cases being identified in El Paso County. So monitoring what's happening in the rest of the country and in the state, helping us inform our planning strategies so that we have operating procedures in place, we have action plans for how we would respond, and then we also have specific teams designated so that we know who will be responding and what their roles will be. That operational coordination that leads into that includes training for our team. It includes developing communications materials and templates because, again, we work with fairly narrow windows when we're responding, so we have to be prepared for that. And then in the training and exercises components, you can see a few examples of how we have prepared for these various responses. In the case of measles, doing training and exercises internally with our team in preparation, and then also responding to communicable disease. We want to be sure that we are taking care of our team members as well and protecting them from respiratory illness, so we do training around appropriate respiratory protocols and donning and doffing of equipment. Next slide, please. So specific to the public health emergency preparedness funding, again, we're in a 5-year contract. This is year 1 of that 5 years. You'll note on the slides we do have what our funding level was last year and the funding level we're at for this year. We are at 75% of the award, and that is due to a reduction in funding coming from the federal government to the state and then passing on those reductions to the local level. With that, there is a reduced scope of work as well, so some of the deliverables around some community education efforts have been removed from the scope, as well as extending the timeline for some of our plans. Under this funding, we developed several plans that guide our activities. So with the reduction in funding, the timeline of some of those plan deliverables will be extended as well. And to accommodate that reduction in funding, we also have a vacant position that we will not be refilling so that we can accommodate the reduction in funding as well. And then these goals are really around being able to respond rapidly and nimbly to public health response activities. And we document that through our incident action plans, our after action plans, and how we implement changes based on those. And then because both of these contracts support the same program, I'd like to go over the CRI funding as well. The City Readiness Initiative is additional funding that came to support public health response initiatives in 2010, and this funding is really focused on areas where there are large population concentrations. So trying to focus on where the largest populations are so that we can move medical countermeasures to different public health emergencies or bioterrorism attacks swiftly out into high concentration areas of population. So in Colorado, this funding is specific to El Paso County, as well as the larger Denver metro area receives additional funding through CRI. This is really related to us being able to receive and distribute strategic national stockpile supplies and having plans around how we can quickly distribute that throughout the community that we serve. We are also required to do exercises around this to demonstrate our readiness for this. We did a large exercise where we mobilized community and used spaces throughout Colorado Springs, and I believe it was 2017. And then the COVID response also meets the deliverable of demonstrating effectiveness of being able to mobilize community scale response. So in the future, I anticipate we will have another exercise deliverable where we work with partners, including our Medical Reserve Corps volunteers, to be able to exercise being able to distribute medical countermeasures throughout the community. Under this funding, we also have MOUs with all the military installations. They are required to have an MOU with us so that when and if strategic national stockpile supplies are received to respond to an event, we work closely with military partners to be able to distribute that to the community. So we have MOUs with the 21st Medical Group, the 10th Medical Group, and Evans Army Hospital as well under this funding.
And Deanne, just for people listening in, could you just let them know what MOU is, what that is?
Thank you. Memorandum of Understanding
It's an
with
agreement,
the
yep.
Entities that we partner with.
Yep, thank you.
And you'll note here as well a reduction in funding. However, that is more related to a delay in the contract than an actual change in funding. We did receive an option letter that extended the previous contract for 1 month. So there was 1 month of this funding that was preloaded under the previous contract, and now this contract is an 11-month period. So this is not a reduced funding on the whole, but in this contract cycle, there is a different representation of an 11-month period. And that's the information that we had prepared to share with you regarding these two contracts, but both Daryl and I would be happy to answer any questions from the board regarding these funding streams.
Okay, well, thank you for the presentation. I see there's one hand up online. I don't see anyone in the room, but so we'll start off with Dr. Chan.
Yes, thank you. Could you tell us how the funding for this coming year compares to the funding that was received in the 2018 to 2019 year?
I can share with you how it compared to last year. I would have to go back and follow up for 2018 pre-pandemic funding. I will say generally this team has been supported entirely on these two grant funding streams, so I would not expect a significant deviation, but I would have to go back to provide that in follow-up. Dr. Chan, I apologize. I don't have that at my fingertips.
Are you anticipating then that the funding for this coming year is basically going back to business as usual pre-pandemic?
So not entirely. I think there is a change in approach regarding the public health emergency preparedness funding streams, and I don't think that this is specific to receding back to pre-pandemic levels. Most of the modalities that supported pandemic funding were through other funding streams such as ARPA and some specialized CDC funding sources that were specific to the pandemic. This has been fairly consistent and baseline funding for us over a multitude of years, including pre-pandemic, but the specific numbers I would be happy to follow up with.
Okay, so the 25% reduction from the federal stream of funding from the last fiscal year compared to this fiscal year really has nothing to do with the bump up in COVID funding that was received in 2024?
No, the increased COVID funding was not through these baseline emergency preparedness funding streams. They had their own dedicated grants and funding streams that were specific to the pandemic.
Okay, all right, thank you.
Yes.
Anything else, Dr. Chan?
No, thank you.
Okay, thank you. And anyone else online? Mayor Dixon, Dr. Vu? Okay. Any questions from in the room? Nope, nope, nope. I don't have any either, I don't believe. So if there are no other questions, I would ask, for a motion to approve the Public Health Emergency Preparedness and the City's Readiness Initiative contracts in a second.
I move approval of items 6A and B.
Okay, so motion made by Commissioner Geithner
A second.
and a second by Courtney Salt. I don't see anyone, with their hand up or anything, so we'll just go ahead and vote. All those in favor, please say aye.
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 Any opposed? All right, so 6A and B pass unanimously, 7-0. With that, we'll move on to item number 7, which is a resolution to recognize revenue and appropriate expenditures for contract funds for epidemiology, laboratory, and capacity. And again, on this one, we'll need a motion and a second after Deanne kind of explains it to us. Go ahead, Deanne.
Thank you. And again, this is an area that would fall to our Division Director, Janelle McNair, so I will be presenting in her absence. But with us today is Haley Zachary, who serves as our Division Manager for Communicable Disease and can help us with any detailed subject matter expertise that you would like to know about these funding streams and activities. Our epidemiology and laboratory capacity funding, in this particular one, we do not have a contract for you to approve because this is being extended by option letter from a previous version of this funding. And so we don't have the contract to vote on. We do, however, have a resolution to vote on to appropriate the funds and expenditures into our budget because this was funding that we did not anticipate would be renewed, so it was not built into our original adopted budget. So that's why we do have a vote for this today, but a slightly different type of vote for today's work on this area. So this is a funding stream that has been in place for an extended period of time predating the pandemic. However, it was during COVID that these funds started to be distributed to locals. So the ELC grant was typically held at the state level. There was increased funding, Dr. Chan, to your question about changes related to the pandemic. This is one of the areas where we did receive additional funding during COVID. It's one of the last remaining areas in the recovery period that is still receiving renewals for this type of funding. And one of the interesting things about this funding is it's helping us with our statutory requirements to investigate outbreaks. There is a particular focus in this funding around outbreaks that impact, that are brought on by respiratory viruses, so RSV, influenza, as well as COVID-19. And with this funding, there is also an emphasis on long-term care facilities and child care centers. Up until this year, CDPHE did all of the long-term care investigations for COVID-19 outbreaks. In this round of funding, it will support us assuming responsibility for those outbreaks at the local level, as well as response to other respiratory outbreaks. This also applies additional funds for data modernization efforts. One of the things that we have dealt with over the years through the pandemic and coming out of the pandemic is a need to modernize some of the data systems within public health. That was an area of public health infrastructure that was quite lagging during periods of high activity. So with this funding, we also have the opportunity to do data training for things like Power BI and R for our epidemiologists in the agency to increase our skill and capacity in these areas, as well as focusing on outbreak response. This funding is very similar to the funding amount that was received during the previous 12-month period. This period is a little bit, there is a reduction in funding, but there's also a shorter timeline in which to utilize this funding. I will also note that this was one of the funding streams that earlier in the year we did receive a stop work order on the epidemiology and laboratory capacity funding that was in place at that time. So the funding continues, so there has been another round of funding. But certainly this is one of the areas that we did not budget for, which is because we didn't expect that this funding would continue, and that's why we're bringing forward a resolution to appropriate those funds today. And then if you would move to the next slide, please. Because this funding stream is focused on outbreaks, we want to give you a sense of the number of outbreaks that we investigate in El Paso County Public Health. So this is from our communicable disease program, and it is outbreaks of all types, because the fundamentals of an outbreak investigation are very similar regardless of the source of the type of outbreak. So of course you'll see a steep increase with the increase in outbreaks related to COVID, and also coming out of COVID response, we still see an increase in outbreaks above baseline. And there's a couple of things that may be contributing to that. One is increased detection of outbreaks. Our team in communicable disease does a lot of work with partners in long-term care facilities, in schools and child cares, with our hospital partners to be able to identify and respond to outbreaks. We also have modalities for individuals in the community to report concerns that may be related to foodborne investigations and outbreaks as well. So we do feel that there's been an increase in our ability to identify outbreaks, but of course then an outbreak of any source we are required to investigate. So our baseline level of outbreaks does not match pre-pandemic. This funding helps support our team to be able to respond to outbreaks of any type.
And just to be clear, Deanne, although above in the slides above it highlighted respiratory diseases like RSV and flu and COVID. This, I think you're pointing out, it also covers measles, digestive things, intestinal things, everything, right? Any outbreak.
Yes.
Yeah.
In our requirements for reportable conditions that we investigate, it includes outbreaks of any type. So this is every type of outbreak we investigate. The respiratory emphasis in this funding is in place, so we have the ability to have attention to that, but the principles of that are the same for all of these outbreaks. The staffing, the training, the documentation, data collection, very similar regardless of the modality of the transmission or the type of infection.
And this is really this is bread and butter for public health, right? We have an outbreak of a disease, we need to find out what it is,
Yes.
why, et cetera. Okay.
Yes, one of our core statutory requirements is to control the spread of communicable disease. So that is the work of our CD team responding to that and trying to identify source and stopping transmission in the community.
Gotcha.
I have a question and a comment.
Yeah,
So
Vice President Ralston.
my understanding is then after the night, this program is embedded in all the programs, so no additional staffing would be
Yes.
needed. So this is kind of like extra funding, is that right? That, I mean, we've had it before. I'm just trying to clarify that, since we're not going to need, it's embedded in all the programs that we already have, so no additional funding is needed after the 9 months. So it doesn't affect staffing is really what my question is.
So we are doing essentially payroll splits, so existing staff are being added to this funding so that we can utilize this funding to support existing staff, but we are not adding any new staff under this funding because the funding is unlikely to continue past this extension, or at least not in this type of amount. So we want to plan cautiously for that. So staff are being added to this grant, but it will not be we will not be adding new staff. And it supports more than communicable disease. We also have some of our environmental health team that works with child care establishments on this, as well as a portion of our emergency preparedness response team that we discussed earlier.
Thank you.
Okay. Yeah, Commissioner Geithner.
Thank you. So one of the things that you said is that this was related to the funding that we got to stop work order on previously. So my understanding and remembrance of that was that is because this is federal funding that the Trump administration is attempting to stop, and this is the one that Colorado is suing over?
That is correct.
Okay, and so that is the reason why it sounds like you're saying this, we don't believe this will continue?
I don't believe this will continue because I think this is also supporting some of the after action from the COVID response where we're focusing on data modernization and outbreak response. I do think we have higher levels of activity and would love to see something continue to support communicable disease, but I think it is unlikely that this level of funding will continue in this same modality.
So do we have any update on that lawsuit in particular? And because I don't know, could this be actually stopped sooner than that? I mean, could it be still clawed back if the courts, weigh in on this? I think a lot of those lawsuits have been pretty tenuous at best. So I'm just concerned that even if we approve this, is it a sure thing?
And I think that also speaks to some of the reason why we are trying to disperse this across several team members in multiple areas, because if it were to stop, we have some other opportunities through the CDC infrastructure or other funding to continue support. So we also are trying to be mindful of any trainings that we plan on this to not involve travel, so that we're not committing to something that we may then have challenges in responding to. So I think there are uncertainties in this environment, and we're trying to act cautiously. so that we do have contingency plans. Regarding the status of the court case, I don't have any recent updates regarding that, but I think this is part of the challenges that we're trying to mitigate with some uncertainty in federal funding and have kind of layers of plans to be able to shift. And of course, our CDC infrastructure dollars being one of the places where we have some flexibility for the next period of time to be able to accommodate a shift. And
just for the record, I don't have any updates on that litigation either.
Mm-hmm. I did look at you, Lori, though. I wondered if you had any. Did you have something else, Madam Vice President? No? Anything else,
I
Commissioner
just will
Geiger?
say, I mean, I've said this before, I think our state is wrong in what they are doing and trying to stop what is happening at the federal level. Our country is in trouble from overspending on all of this, and it's always difficult to be in this situation. We're in this situation, I'm sure the city is all the time, and the county, to feel like we would like to have more funding, but it is a real concern to me, and so I have very mixed feelings about accepting money that I think, quite frankly, our state is undermining our democratic system when the executive branch makes a decision, and then they're using lawfare to try to push this money out before, using the courts to do this. I think that it's a really bad place for us to be in as a nation, and it's poor decision making by our state. So. This is a really tough one for me, and weighing all of that and attempting to, kind of the state distribute this money before the executive branch, who has the rightful, who should have the right, and I think the courts will ultimately decide that, as we've seen in many other cases, to not try to interfere in this, but by then the money is spent. And so those things are all very concerning to me. So I don't know what I will do yet on this contract, but just wanted to be transparent that I'm very concerned. And I may make the choice to abstain or vote against this one for those reasons.
Okay. And I'll look for, I do see, I'll just say before, I'm going to go to you next, Dr. Chan, and I'll just go to you right now. Go ahead, Dr. Chan.
I'd just like to clarify my understanding. This is a one-time grant as far as we know. And what I thought I heard you say is that the funds go to support existing team members who are also supported by other funding. But since this is a one-time funding grant, is it going towards systems and capital investment, or is it going towards personnel?
The majority of this funding is going to go to personnel, and that is a variety of splits of existing FTE. There is additionally some operational funding that will go to training as well. And Haley, would you have anything additional to share regarding the funding?
No, that's spot
on. Okay.
And if I could just add this, Lori Seago. I don't know that I would characterize this as one-time funding. This is an annual renewal of funding under a contract that was entered into several years ago under a 5-year term. The two contracts that this board just approved are for 5-year terms, but the funding comes annually, and it comes in the forms of either an amendment to the contract to increase the funding for that particular fiscal year, or it comes in the form of an option letter. This particular funding is coming through an option letter, but it's under an existing contract. So it is funding that we've had for the last few years, and it may discontinue after this particular award. But so I'd be cautious for discussion purposes calling it a one-time grant. I don't think that's accurate.
Okay, so I'm just looking forward a little bit. Rather than looking back at what the funding has been or its renewals have been. My understanding is that there's a high probability that this is not likely to be renewed in the coming years. Is that correct?
That is our understanding.
Okay. So what is the sustainability plan for personnel who are being supported through something that is not going to be renewed?
And that is part of what makes our budget experience very interesting, because we do braid and blend and seek new funding opportunities. These activities for communicable disease are part of our core services and core obligation. So when we look at having to make funding decisions, of course, this would be an area where we have to prioritize and as we look at our whole budget picture, because as the lead entity responsible for the control of communicable disease in El Paso County, and with a growing population, we try not to look at program by program, but what are our responsibilities to the community, and how do we prioritize our funding around those responsibilities? So if the funding doesn't continue, then that's part of our budget development process, where we have to look at how do we accommodate those cuts and changes. And we operate on multiple fiscal cycles, where we have some on a state contract year, some on a federal contract year, and some on a calendar year. So as we go through each of those cycles, we work very closely with the budget team to understand the impacts and to plan around that. So I don't think there's a singular answer, because we have to look at the entire picture of other funding mechanisms and what we need to prioritize within those funding mechanisms.
Well, are there any systems or capital investment needs that could benefit from this funding, such that this funding, if it is not continued, still has a benefit that carries forward, rather than funding personnel in which that funding is always going to be needed?
So, and I would say, with our budget, more than 70% of our budget is on personnel. Our operating budget is relatively small. So ways that we are utilizing this funding to really build our capacity moving forward is that investment in training and systems for our epidemiologists and teams that work in this area. So the impact of having access to training that increases their data analytic capacity and skills is something that helps us build that foundation moving forward. So I think we are trying to do that, but there are also restrictions on the funding and what it can be utilized for. So in terms of capital investments, that's very limited.
Got it. Thank you.
Okay, Dr. Vu.
Hey, Deanne, can I clarify with you, the action on the table at this time is not if we should approve the contract, but the action on the table at this time is to appropriate the funds. Is that correct?
Correct, because of the modality in which this funding is coming to us, which is an option letter on a previously approved contract. We are not seeking approval on the contract, but in order to make expenditures against this funding, we do need Board of Health approval to appropriate the funds and expenditures. And that's the resolution that we have.
Thank you.
Thank you for that question, Dr. Vu. That was useful. Is there any other discussion before we go to a vote? Courtney Salt.
I do have a question. Maybe this is for you, Lori. So with this being tied up in litigation, what happens? We get this money, and then say the state loses the lawsuit. We've already spent the money. Just what does that mean for us?
I don't know. That will be up to the court to decide. And I'm sorry, I don't.
That's okay.
I don't know that the court would order us to come up with some mechanism to pay it back. I simply don't know. Or if it would just take effect going forward, that once the court order enters, then the federal government can enforce its order that all such funding stop.
Okay. I wonder too if the court's ruling wouldn't necessarily be against us directly, but against the state, and then what mechanism would the state have because then they're out the money they've already granted us.
So with the caveat that this has been in the last 180 seconds of discussion, I've done a quick search on this lawsuit, and so please forgive me if I make any errors, but it appears that this lawsuit was instituted by several states against the Federal Department of Health and Human Services, and it was based on a directive coming from the federal DHHS to cancel it looks like about $11 billion in public health funding throughout the country. And so these impacted states sued to try to rescind that order and reinstitute the funding. The various states, including Colorado, applied for a preliminary injunction, basically asking the federal court to pause the clawback or the cancellation of the funding pending the outcome of the litigation. The federal court granted that preliminary injunction and so ordered the federal government to continue the funding or whatever to reverse the effects of its initial order, which is, I assume, why we're seeing this option letter today. The federal government appealed that decision, but then I read that just 2 days ago, all parties agreed to voluntarily dismiss that appeal. So from what I can tell, that preliminary injunction stands. The litigation will go forward. No idea how long that might take or what the outcome might be, but for now, there's an injunction in place keeping the status quo, basically.
Okay, I appreciate that. I have concern with accepting money that we don't know what's going to happen if there's blowback on the taxpayers, because that's who, like, ultimately, this is where the money comes from. And if the federal government's not going to float that bill, we do. And being that we have a budget that doesn't need this money, I'm struggling with it a little bit.
Mayor Dixon.
Yeah, my question is, if we have to return the funds, what's the contingency?
So given that we have an approved contract, we have a contract on offer from the state, if they were, and it's reimbursement based, so a monthly reimbursement, if they were to seek to take back that funding, that would be not in alignment with the contract that we have. So they have released this to us. So I would presume that there would be some protections and that we have an option letter issued by the state, and the monthly reimbursement allows us to keep some pace with the spending of that, so it's not a lump sum payment at the end. So I would be happy to follow up with some questions for the board if needed regarding the specificity of those questions, because we would have to go back to the contract and have additional conversations regarding the specificity of that. But in general, regarding our budget, we have a healthy fund reserve, we have other options for funding, but of course, as a public health agency, blending funding opportunities to support our team, we have other options. However, I hesitate to say that we don't need it, because it's part of the whole picture that makes our budget whole. And of course, we continue to make adjustments to help support the sustainability of the public health budget. And tying together all of those strings is very valuable to us in supporting our teams in place.
Are we under a time crunch on this?
So because it doesn't require signature, we do not have to sign a document on a given date. So if we could revisit this at the board meeting later this month and have some specificity about some of those potential contingencies to allow the board to have more information.
Looks like we have a question from Dr. Vu, or a statement. Go ahead, Dr. Vu. We can't hear you, Dr. Vu. I think you're still muted.
Perfect, thank you. Hey, Deanne, if please let me know if I'm wrong. My understanding is the action on the table at this time is not to accept the fund. The fund has already been accepted. We don't need to approve the contract. And the action on the table is not if we should return the fund now or in the future or not. The action on the table is how to appropriate the fund, because we already have an currently ongoing work that is being done, and we just need to decide to appropriate the fund that we have already accepted. Deanne, is that correct?
And I see Lori reaching for her microphone. So, Lori, do you want to respond to the specificity of the resolution?
Well, I don't know if there's anyone from the county finance here in the audience today, but it is correct that the board does not need to approve any kind of contract in order to accept the funding. But if the board elects to not recognize and appropriate the funding, then public health can't spend it. So that's the action that we're asking, or that public health is asking be taken, is to recognize the revenue and appropriate it into the budget so that it can be spent. And if that doesn't occur, then public health cannot incur any costs that would then be attributable to this funding. Does that sound right?
Perfect, thank you.
Yes.
In addition to, I'd like to add or question that my understanding is the work is being done as we speak. We are doing the work. We just need to appropriate the fund for the work. Is that right, Deanne?
Yes, this is ongoing work that occurs every day with our team. We need to be able to investigate and respond to outbreaks. So yes, this work continues.
And this is a question from me, Deanne. Your recommendation is to go ahead and recognize and appropriate the expenditures now. Is that correct? And if it turns out that a year from now or 6 months from now or whenever that is, there's a court ruling and then the state has to do something, I would say it's perhaps likely that the state will, and I know they're short of funds, but they may get caught holding the bag, not El Paso County. And if so, if they wanted some portion of this back, which you've indicated we have some protections, in your opinion, from that, we'll have ways to address that.
I think there's some examples of this that we've already experienced this year, and that is the stop work order. I think if the state is not able to continue expending against these funds due to court action, we will receive a stop work order. The example that we had earlier this year and how that was navigated is we received a stop work order and notice to provide our last reimbursements under that funding due to the stop work order. Given that experience and working through the state in a similar manner where there was a rapid interruption to the funding, based on that experience, that is what I would anticipate would happen if they were not successful. We would receive a stop work order on the funding, and then we would have to provide our final reimbursements with a very short turnaround, which we've already been through that process. In other areas that similar funding streams related to emergency preparedness, there are others that are navigating that currently. The Healthcare Coalition, that funding ended, so they are also in that situation of kind of wrapping up. So with what we are seeing, that has been the most typical that we have seen, is we get a stop work order, a final opportunity to submit the reimbursements under the grant up to the date of that stop work order. And then, of course, we would have to make other plans at that point. I can't,
Okay.
that is the experience I can speak to, having gone through this earlier in the year.
And so is your recommendation to go ahead and approve it, go down that path? If we get a stop work order, okay, at that point, we stop and we find other funding. Go ahead.
Yes,
Okay.
we've been through that. I think we still have that as a potential outcome for this funding, but having gone through that process earlier in the year, I do think we can respond to that rapidly should it come to that eventuality, that there is a stop work order.
Okay. Dr. Chan.
Yes, so this contract, I just want to make sure that this is a contract that is with the state and that there's no verbiage within the contract indicating that dispersion of the funds is dependent on the state getting the money from the federal government. Is that correct?
Lori Seago again. I have not reviewed the contract recently, but I can tell you that it is standard contract, or excuse me, standard language in any contract with the state, that it is always contingent upon state funds being received, appropriated, and budgeted for these purposes. So if the state doesn't have the funding, then they do not have an obligation to provide it to the county.
Okay, so if they don't have the funding to provide it to the county, say, going forward, for example, if they lose this case, the injunction, if they lose that case, then the funds that are already dispersed, how would they be able to claw that back if the contract between the local government is with the state and the funds have already been dispersed? Because the state always has the option of not granting these funds until they're certain of the outcome of the lawsuit.
So a couple of things related to this that I would point to. So the delays, which resulted in us voting on the emergency preparedness and response funding today versus in June, are related to not dissimilar issues. Those are not being disputed at the court level, but in terms of state contracting, they would not release those contracts until they had the notice of award from the federal government. So I think this is part of the environment that we are trying to navigate currently, is there are delays in the notices of awards to the state. The state is acting conservatively as it relates to committing to contracts in the absence of those notice of awards as part of their risk mitigation related to delays in funding. So they won't release these option letters or contracts to us until they have some confidence in the funding, typically through the notice of the award. In this case, with the injunction still in place, and if that situation changes, we receive the stop work order. We have not seen them request any paybacks of already expended funds under the existing contracts. But I would anticipate that if they lost that court case, we would have a very rapid deployment of stop work orders to local public health agencies.
And so to just summarize that, Dr. Chan, I believe if the court, so to speak, if the state lost the court case in the other states, we would get an order to stop spending from the state, but not necessarily go back and try to claw back what had already been expended.
Okay, so I think that since this is not a lump sum payment and it's rolling reimbursements, I feel pretty confident or safe in approving it for now and then responding if the situation changes.
Okay, very good. I believe, and I lean that way also, especially if that's the recommendation of our interim director to go ahead, appropriate the funds based on history of how this has gone in the past. I would be in support of doing that. Commissioner Geithner.
Yes, thank you. I want to point out that actually our attorney said she doesn't know that could or could not happen. So I don't think that it's clear that there could not be an ask for returned funds. But also, it is a reimbursement. So yes. In the case that that we had not gotten through a reimbursement period, we could expend funds that would not be reimbursed at this point with the expectation that we're going to get those. So that is still a bit of a concern for me. But the bigger question to me is this. If we were to get one of those stop work orders immediately, or we're just planning for the fact that we don't believe this is going to exist, because clearly the federal government does not want to have this money go out anymore. That is clear. What is the plan for when that happens, whether it is tomorrow with a stop work order or at the expenditure of this, even if it does go forward? What is the plan for either filling that or reducing the expenditures of the organization to do that? Because I do think that we've expanded that. We've expanded staff here over the last few years. Yes. And as these things are contracting back down over COVID, and that funding going away, can we nimbly react in a way to retract that if that stop order comes tomorrow? Or are we, taking this and realizing that could come to an abrupt end at any point? And I think that's truly a concern that I have. And if we know it's coming to an end, is this just to continue to sustain staff to do this for the next, short period of time, and that's no longer going to exist, or what is that long-term plan?
And I'm happy to speak to some of that. So, absolutely correct. We have expanded our staffing over the recent years. However, we are also taking steps to right-size the agency to a more sustainable place. So we started this year with 195 FTE. We are currently at 187, and most of that is through attrition and vacancies and making informed decisions regarding the opportunities in front of us in terms of funding. And we spoke to that earlier in the meeting when we discussed that there's a vacancy in EPR that we're not refilling. So along the way, because we operate in all these different fiscal years, we are trying to create space in our budget to have room to maneuver, because there are uncertainties with public health funding moving forward. Absolutely. So we're not delaying trying to make well-informed decisions now to get us to a more sustainable place. And then with some of this, there's also we did not budget for this funding because we were uncertain of it. So I am grateful for our Chief Financial Officer and our county budget team who have supported us over the years, and now we're working internally with our own budget team. But that conservative assumption, I think, also creates a little bit of space for us to maneuver, because we didn't make the assumption that this funding would continue. So we did plan for staff for this year to be on other funding mechanisms to create space in our budget. We have other things coming in slightly lower. So we're trying to put together these pieces to create our whole picture. And then within environmental health, we have a staggered increase in our retail food license fees over the coming years that was approved by the state. So that's another area where there's some good news for our budget coming in. So this is part of how we're trying to be conservative, trying to create space to accommodate some of these unknowns, and be as transparent as we can be with our staff as well about some of the funding uncertainties that we are facing.
What was the staffing number prior to COVID? How many?
It was 158 FTE.
And so is that the baseline budget we are expecting to return to?
So I think that is, it's a benchmark. I would hesitate to say that that is the goal, because population has increased since that time. We're looking at the graph of increased outbreaks. We have more inspections in environmental health, and benchmarking us against a national average, we're still well below the national average in staffing. So I think it's rather than saying there's an end goal, it's a constant cycle as we go through these funding streams about what is sustainability, what are we doing, and why are we doing it. And that's really what our executive team has been talking about quite a bit, is being well-grounded in what we're doing and why, and what is the sustainability of that, so we can plan around that and have contingency plans. Because with some of the uncertainty in public health funding, I think contingency plans are going to be very important to us moving forward.
So we talked about numbers, and I understand you're talking about needs as well, but I guess I'm referring more to from a budgetary standpoint. We had a pre-COVID budget.
Mm-hmm.
We had a huge influx of what was not necessarily always meant to be long-term funding. So where do we expect that budget number to be back after we see all of this pandemic funding kind of going away? What is sustainable for the organization in terms of employment? Because that to me is where this in particular grant, are we just prolonging the inevitable here? Are we continuing to say we need to have all of these people, but we know that this money's gonna stop and then we're gonna fall off the cliff? Again, whether that's tomorrow or next year.
And I'm going to ask Deanne to go ahead and answer that. That's a real broad, good question. But to just get through what we're trying to deal with, item number 7 here, I'm going to try to bring it back after this answer, okay?
Yeah, I think it's actually very
vote.
relevant to this grant, though, Dave. I need this information to make a good
And that's
decision.
why I'm going to ask Deanne to answer that.
Thank you.
Please.
And so with our staffing, we are eliminating vacancies. We are trying to downsize to a more sustainable place. Because of our statutory requirements around the control of communicable disease and how rapidly that team has to stretch when we have a time-limited response, that makes it very difficult for this team to be an area where we would have to make reductions, because we just went through some response for measles. This team is stretched very rapidly for those types of large-scale responses. So we have to look at other areas and look at, prioritizing vacancies that we don't refill, looking at program-specific grants and what we are backfilling, and we may not be able to backfill that anymore. So what does that look like, so that we can prioritize funding for areas that, in this case, we don't really have a choice. We are required to respond to these by statute. Our community expects us to be able to respond to communicable disease in a meaningful way. And so this in particular helps us with that. And we are working diligently to look at sustainability for the agency. The CDC infrastructure funding gives us time to do that in an intentional manner, so that we're not rapidly retreating, and have some space and time to make strategic and well-informed decisions to draw down to a level where we have more sustainability. In the current environment, with a lot of changes at the federal level that we don't yet know what the impacts will be, and also concern for state LPHA funding in the next state budget year perhaps being reduced, we don't know those numbers yet. So from my perspective, I feel like we're looking not at one singular decision point, but many adjustments over a prolonged period of time as we go through these various funding cycles and get more information about what we're dealing with. Because we don't know all of those budgetary considerations yet, because we don't know at the next cycle what will be reduced. We may encounter during the federal contract cycle additional unknown reductions. So we are trying to be very mindful of that, and I think we all acknowledge that we will have to reduce FTE. We are actively doing that now.
Just one more point to make a clarification. So
Okay,
if we,
Vice President Ralston, yeah.
so if we decided not to recognize this revenue and appropriate the expenditures, what would the impact be immediately to our local public health agency?
I think the most immediate impact is we won't be able to take part in some of those data modernization trainings that we had planned through this funding, or we would have to look for other funding sources. For our existing staff, for which we are utilizing this to support some of our existing personnel, then that means that we don't have that as a buffer to accommodate how we piece together our funding, and that means if we go back to our original adopted budget plan, which puts downward pressure on our budget, but we do have plans in place because we weren't counting on this funding. So it's more of how we mitigate all of these changes as we move forward.
Okay. And I don't see any hands up online, so what I hear our interim executive director really asking for is some flexibility to use the funds as she has described, recognizing that full-time employees are based on expected funding, are in a downward trajectory, recognizing COVID money is reduced and dried up and essentially gone away. And that's reality, and the funding sources fluctuate, and this is a part of that fluctuation. So what I hear is a request to allow her to use this funding as it's being, until it is basically halted by the state. So with that, I would ask for a motion and a second to approve this resolution to recognize revenue and appropriate the expenditures for contract funds for epidemiology, laboratory, and capacity. Is there a motion?
Deborah Chan, I'll move to accept the resolution.
Okay, so a motion from Dr. Chan to accept the resolution.
Doris Ralston, a second.
And a second from the Vice President Ralston. With that, I suspect there'll be some no's, so why don't we go ahead, we'll just go through and do this by our roll call. And so we'll start off, I'm first on this, aye. Vice President Ralston.
Aye.
Commissioner Geithner.
Yeah, I'm going to abstain, and I just want to add with the comment that I'm concerned about the entire trajectory of the organization. I'm concerned with us accepting money that's tied up in litigation, and the continued reliance on trying to grab for money that is related to COVID when we should be moving on from that. Thank you.
Mayor Dixon.
Well, my preference would have been to table to get a detailed plan, but it sounds like there may be contingencies available, so I'm going to go ahead and say aye.
Dr. Chan.
I'm going to say aye, but I agree with Commissioner Geithner in that we need to be moving on from COVID and COVID funding. But I'm saying aye.
So that's an aye, thank you. Courtney Salt.
I'm going to be a no. I would have liked to have seen some more clear answers on the contract and what's going to happen.
And Dr. Vu.
Yes, please.
That's an aye. And so let's see. We started off with 7. So we had, I believe, 5 ayes, 1 no, and 1 abstention. And so it passes. I will ask our interim director at our next meeting to go ahead and present some of that information. If it's stopped, what is our plan? Okay?
Yes.
Okay, I appreciate that. And thank you for that, we'll call it a robust discussion. And with that, we'll move on to item number 8, which is the executive session. And I believe I'll hand it over to Lori Seago to help read us into, well, I guess we'll have to vote, but just say whatever it is you like to say first, then we'll vote, Lori.
So I'll just give an introductory statement for our newer members. An executive session is an exception to the Colorado Open Meetings Law that allows a public body to meet outside of the public purview. There are identified reasons for doing so in state statute, so you have to fall under one of those reasons in order to hold an executive session. The public body does have to vote to go into executive session, and a motion to go into executive session has to pass by a 2/3 vote. So 4 out of the 7 members present would need to vote yes in order to do so, if my math is correct. 2/3? No, let's say 5. I think 5 is correct. So 5 out of 7 would have to say aye. If it passes at that time, staff and anyone else who is not directly involved in the executive session will leave. We will record the executive session, but it will not be open to the public. So having said that, I will read into the record the agenda item, and then, Mr. President, if you could call for a motion. Executive session pursuant to CRS Sections 246402, 4B, and F for a conference with the County Attorney's Office for the purpose of receiving legal advice on specific legal questions pertaining to the recruitment and hiring of a public health director, and to discuss personnel matters not specific to any individual employee concerning the recruitment and hiring of a public health director.
Okay, thank you, Lori. Is there a motion to go into executive session?
Doris Ralston, so moved.
Thank you. Vice President Ralston so moves. And is there a second?
Second.
Second.
Okay. All right. And thank you, Mayor Dixon, but Commissioner Geithner had already seconded it. So motion and a second. All those in favor, please say, well, do we need to do it individually, the vote? By name? Okay. Okay. I will go first. President Donaldson, aye. Vice President Ralston?
Aye.
Commissioner Geithner?
Aye.
Mayor Dixon?
Aye.
Dr. Chan?
Aye.
Courtney Salt?
Aye.
And Dr. Vu? And it appears he may have stepped away. I see he dropped off the call there. Madam Attorney, how should we record that? 606? Oh, he's back. Dr. Vu, can you hear us?
I can hear you. Sorry, I needed to get in my car.
That's fine, Dr. Vu. We're about to go into executive session, so we're voting whether or not to do that. How would you like to vote, aye or nay?
Yes, please.
No, I'll take that as an aye. And,
Yes.
okay, so 7-0. It looks like Mayor Dixon has his hand up. Did you have a comment?
Yeah, I'm in an uncontrolled environment, so I will be bailing out as you guys go into an executive session.
Okay, bail out. I'm not sure what that means.
Okay,
But
see you.
be careful. All right.
Okay.
Talk to you later, Todd. Okay.
Bye.
So that was unanimous, 7-0. I think we'll need a few minutes to prepare the room. I
Yes.
anticipate for anybody that's watching this online, if there is anybody doing such a thing, when we come back out of executive session, all we will do is adjourn the meeting. There won't be any other meeting after that. And I would anticipate maybe an hour, maybe, not sure exactly. So with that, Madam Attorney, is there anything else we should say before we
that covers it.
prepare the room? Okay, so I would ask staff to prepare the room. And we'll take a 5-minute break.